You know, we have heard time and time again that life can't return back to normal until we have a vaccine that's available to the public. Two are in their last phase of trials here in Maryland, and researchers are looking for people to volunteer to be a part of the effort to end this pandemic. WMAR2 News' Abby Isaac spoke to an investigator about these vaccines and what they're looking for.
They're looking for 30,000 people to enroll in these trials, particularly people from populations hardest hit by COVID-19, to make sure these vaccines work in prevention.
Am I going to be able to see my grandchildren if I get COVID? When am I going to be able to see my friends and family again?
These questions are on the minds of so many as the pandemic continues. And health officials say the only real way to end the uncertainty is a vaccine.
Where we can know that we can prevent people from becoming ill, from being, from having to be hospitalized.
Anna Durbin will lead a vaccine trial through Johns Hopkins University. It's one of several going on across the country as part of Project Warp Speed, which is government funded to evaluate and produce multiple vaccines to prevent COVID-19. The pace of these trials has scared some people, but she says they're not cutting any corners on safety. Yes, they're moving into the last phase sooner than a non-pandemic timeline, but she says it's for good reason.
If you look at the risk-benefit ratio, there's very little indication that there would be any long-term safety problems from the vaccine, that there's more of a safety issue and health issue with waiting a year before you initiate these phase 3s, because we would have, probably millions more people certainly infected, if not killed by COVID, if we were to wait.
2 vaccines are moving into that final phase in Maryland. Durbin says the earlier phases showed encouraging results, and the most common side effect was a sore arm.
People are concerned, are you giving me the virus for this vaccine? And we say, no, we're not giving you the virus. This is not a COVID virus. It can't reproduce within you.
Their goal is to enroll 30,000 people by October, and they're doing outreach targeting people who are being impacted most by COVID-19. The elderly, people with comorbidities like diabetes or obesity, and the Latinx and African American communities.
There's a lot of mistrust within these communities about research and about certainly the government and things like that for a lot of different reasons. So we are spending a lot of effort and time to really work with these communities to help them understand why we're doing these vaccine trials, why we are reaching out to them particularly.
Enrollment for some of these trials is going on right now, and others will start later this week. We have more information about how to volunteer on our website, wmar2news.com. In Baltimore, Abby Isaacs, WMAR2 News.